Welcome back to Lab Talk, where we break down the science behind laboratory diagnostics and how it may impact patient care. Today, we're diving into a game-changing hematology parameter that provides helpful insights into anemia, reticulocyte hemoglobin equivalent, or RET-He. Anemia is one of the most common conditions we see in the lab, and traditional tests don't always tell the full story. That's where RET-He comes in. It reflects iron availability for red blood cell production in real time. So, if you're a clinical laboratory scientist, a physician, or just someone curious about the pathophysiology of RBCs, this episode is for you. Let's get started. First things first, what exactly is RET-He? RET-He is a direct measure of the hemoglobin content in reticulocytes, the young, immature red blood cells that have just been released from the bone marrow. Why does this matter? Because reticulocytes give us a real-time snapshot of bone marrow activity. Unlike traditional red blood cell indices like mean corpuscular hemoglobin, also known as MCH, which reflect hemoglobin in mature RBCs that were formed weeks ago, RET-He tells us what's happening in the bone marrow today. Knowing the hemoglobin status of these immature cells may help clinicians assess the functional availability of iron in the bone marrow, offering additional clinical information for managing patients. Now, let's talk about why reticulocytes matter. Recall that RBCs carry oxygen throughout the body thanks to hemoglobin, a protein that requires iron to function properly. When a patient becomes anemic, the body senses the low oxygen levels and signals the bone marrow to ramp up RBC production. This leads to an increase of reticulocytes in circulation. But here's the catch. If the patient doesn't have enough iron, these newly formed reticulocytes will have an abnormally low hemoglobin content, leading to continued oxygen transport issues. This is where RET-He adds value. Along with other RBC indices, RET-He may provide a better understanding of the quality of the patient's reticulocytes. Now, let's talk about the technology behind RET-He measurement. Sysmex XN series and some XNL series analyzers use a combination of fluorescence flow cytometry, proprietary fluorocell RET reagent, and automated calculations. Fluorescence flow cytometry technology differentiates mature RBCs from immature reticulocytes based on the RNA content. Fluorocell RET reagent stains the reticulocytes and allows for accurate measurement of the hemoglobin content. Then the analyzer calculates the hemoglobin concentration of reticulocytes without the need for manual dilution or additional reagents. So what's the benefit, right? Unlike traditional RBC indices, RET-He provides a direct and real-time measurement of hemoglobin in newly formed RBCs, making it a useful tool for clinicians managing patients with hemoglobinopathies. So how does RET-He compare to traditional anemia biomarkers? Let's talk about RET-He versus MCH, mean corpuscular hemoglobin, first. RET-He reflects real-time bone marrow activity, while MCH reflects RBCs formed weeks ago. This makes RET-He a more reliable, real-time indicator of iron incorporated into newly formed reticulocytes compared to MCH, which is looking at older RBCs. Next, RET-He versus ferritin. Ferritin is a protein that stores iron. Measuring a ferritin level can give information about iron stored in the body. However, ferritin is an acute phase reactant, meaning it can be elevated in patients with underlying inflammation. Now, remember that RET-He is not an acute phase reactant, making it more stable and reliable in patients with inflammatory conditions. Next, let's talk about RET-He versus transferrin saturation, also known as TSAT. TSAT looks at a protein, transferrin, that carries iron throughout the body. TSAT measures the circulating iron, but that result can fluctuate throughout the day depending upon diet and other factors. RET-He provides a stable measure of iron being incorporated into new RBCs. This makes RET-He a helpful additional tool for managing patients with challenging hematological conditions. So, what are the benefits of RET-He testing? 1. RET-He detects decreased iron availability in real time, which may be earlier than traditional biomarkers such as MCH or ferritin, providing valuable insight for clinicians. 2. Since RET-He isn't an acute phase reactant, it may add value in patients with inflammatory conditions. 3. RET-He can be ordered as a standalone test or as part of a reticulocyte panel. 4. Serial testing may be helpful in monitoring iron availability for red cell production. And remember, Sysmex XN and XNL series analyzers have the capability to measure RET-He with existing fluorescence flow cytometry technology, and no additional reagents are needed. This means faster automated results, impactful data for clinicians, and more comprehensive patient care. All right, let's wrap things up with a quick recap. First, RET-He measures the hemoglobin content of reticulocytes, giving a real-time look at iron availability for red blood cell production. Second, it's an early and direct indicator of functional iron availability. Third, Sysmex analyzers use fluorescence flow cytometry to provide highly accurate and automated RET-He measurements. Last but not least, RET-He may provide useful information to clinicians managing patients with challenging hematological conditions. So, the next time you see a RET-He result, you'll have a better understanding of what it's telling you about your patient's iron status. Well, that's it for today's episode of Lab Talk. If you found this discussion on RET-He helpful, be sure to subscribe, leave a review, and share this episode with your fellow lab professionals. Got a question or a topic suggestion? Drop me a message, and let's keep the conversation going. Until next time, keep learning, keep questioning, and keep making a difference in the lab.